Do the choices people make in their daily life influence their health? Are they taking the right decision to be the best version of themselves? Physical activity and diet are two key factors of a healthy lifestyle. But both are not only difficult behaviors to change in the long term, they are also difficult to measure reliably. TU Eindhoven, TU Delft, University of Twente, and Wageningen University and Research joined forces and created Pride Prejudice, a research program that focuses on design of technologies for behavior change and real-life monitoring to prevent chronic diseases. This program features a unique combination of disciplines involving physical, life, information and communication technology, design, behavioral and social sciences. Although the word technology is in its name, the nature of TU Eindhoven research is very human-centered, considering various aspects of human-technology interaction on individual, community and societal levels.
Here at Systemic Change Group of Industrial Design Department at Eindhoven University of Technology, we tackle complex challenges of today, and we do that in collaboration.
If you look at the PNP as a great platform with a diversity of expertise, then this NutriLab is a small initiative that we're trying to develop nutrition assessment, monitoring, intervention methods and tools together with colleagues from Wageningen University.
With NutriLab, we are working on a chatbot to monitor the dietary behavior of cardiac patients. They are taking part of a rehabilitation program in which they try to improve their lifestyle to have a better result of their cardiac interventions. So we developed a chatbot with a really easy structure that they can select a food category, then a food item, and then the portion size to really make the patient burden lower and make it simple to use for the user.
One of the best things about Pride Prejudice is that it did not only incubate the research that has been done so far, but also allow spin-offs such as Inno4Health project.
Inno4Health is a joint effort from about 30 partners in 6 different countries, and it's about innovating in the area of health and sports. Mainly, it's about continuous monitoring of patients and athletes. So right now we're working on the Dutch medical use case. It's about cardiac patients who undergo cardiac surgery. We are trying to put the user in the center of their own data using sensors like this, for example, and help them make decisions based on this data about their journey and motivate them to keep up their behavior change.
Artificial intelligence technology will be used in this project in order that we can create fitness, performance, and health assessment. The purpose is that we can make available this data to the users, so then the users can make decisions about their own goals.
So the Inno4Health is related to Pride Prejudice because we're trying to lower the death risks of a risk population, and we're trying to do that with technology, and we're trying to eliminate the prejudice that a healthy lifestyle is impossible after a very dramatic health intervention.
Poor diet quality and food overconsumption are acknowledged determinants of adverse health outcomes at the global scale. More personalized approaches seem key in the design of more successful interventions. At Wageningen University, they aim to improve global health and well-being through better nutrition.
At the Division of Human Nutrition and Health, we are already working for years on the development on devices to measure dietary intake and eating behavior. Initially, we assessed eating behavior and dietary intake using questionnaires, interviews, and gradually this shifted more towards the use of desktop computers, where we administered the questionnaires online, and smartphone-based technology as well as sensors. One of the collaborations with Eindhoven is really focusing on the Track app.
Track is the first flexible dietary assessment app. We can use it as a food diary and also as a recall. Everybody knows the food diaries apps because these are also commercially available. But in the recall methodology, we can ask people what they consumed over a previous time period. The app is developed in such a way that we can completely tailor it to a specific research question. Participants receive notification on specific days and times. And when they miss a notification, the system will automatically repeat on the same time on a different day to ensure data completeness.
We're now also exploring with the Technical University of Eindhoven if we can more shift towards the use of photographs and artificial intelligence.
Human nutrition research is dependent in a large part on gathering data on what people eat and how they are eating. And what we tried to develop is a system that allows us to measure eating behavior automatically.
So we developed a tray that has 3 weighing stations, and so you can measure continuously over a meal how much people drink and eat. And then we also have a video camera, and with that camera we can detect how somebody eats, so how many times they chew and how many bites they take. And from that information we can tell how fast someone eats.
And now we're going to make new iterations of the system where it becomes more and more natural to use. And we want to develop it into the future where the camera is less obtrusive, the weighing stations are flatter, so that it becomes more and more a natural eating experience.
And right now the data is sent to a laptop, so the laptop should be close to the meter or the tray. And in the future we want that to be the data stored in the tray itself. And we also will like to compare the data from our first experiment with the tray with a weighing table that they work on in the University of Twente. There they eat together with other people instead of individually as we tested it. So we will compare the 2 studies and how that affects how somebody eats and how much.
Modern mobile devices are increasingly used to help people manage their health. But while these technologies are nowadays increasingly in our daily lives, people often stop using them. Why is that? At the University of Twente, the focus is on the impact of technological developments on society. They are investigating with a multidisciplinary approach how health-related technologies can be developed with which users can interact in a way that is meaningful to them.
So our project starts with our goal of supporting healthy eating. And of course, there are already a lot of trackers out there and diet plans out there, but they're mainly focused on the individual. We argue that healthy eating does not only happen on an individual basis, but also on a social level. So think of the breakfast that you have with your partner, or the lunch that you have with your colleagues, or maybe even the dinner that you have with your family or friends in the evening. That's all on a social basis. That's why we created the sensory interactive table. The table is basically a big dining table, and in the table are integrated a lot of load cells that can measure all the weight shifts around the table. So in this way we can measure how many bites you're taking, or how much weight is on the bites that you're taking, but also how much food is being placed on the table. But also through the interactive surface of the table, which is a huge LED panel, we can interact with the diner to steer the behavior of the diner or to support the diner in their behavior change goals for their diet plans, so that we can interact with the social space of eating.
A lot of the work that we also do looks at the individual perspective. So if we look at a lot of the tools that we have in our lives, like our watches, like smartwatches or phones, they already give us information about our behaviors. They tell us how much we walk, they tell us how much food we've consumed. And one thing that we've been noticing is that people tend to feel quite demotivated sometimes from this information. So another thing that we're looking at is how we can personalize the feedback that we're giving to people, how we can allow them to customize the feedback that they're seeing to make these interactions with these tools a bit more positive. So the next steps are to think about guidelines that we can give to the developers of these tools to actually start incorporating ways to support people to actually change their data and play around with their data in ways that actually work for them and in ways that actually motivate them to use these tools.
The digital twin is a technology that takes personalization more or less to the extreme. It intends to offer an in silico representation of an individual that represents molecular and physiological changes. And together with 3 colleagues, Marina Bos de Vos, Sander Mulder and Carla Strasser, we investigated how people wanted this digital twin to be integrated in their lives. because health is only one value amongst others. Which values people tend to find important? For example, on the basis of our interviews, we found out that people would rather like to interact with their digital twin as a bank, which they could visit on their own liking. They would preserve somewhat more autonomy in when they would like to interact. What it shows is that when we want to integrate technologies, it is needed to investigate which values people adhere to before these technologies enter society.
A holistic perspective is needed to develop solutions which are more than one-size-fits-all solutions. At TU Delft, the education and research is based on human-centered design principles, exploring a specific problem to understand the user and context of use, by focusing on people's individual experiences and system-related topics.
One of the research projects we have done is looking at the emotion of disgust and how it's involved in healthy food promotion. For that project, I've collaborated with a philosopher at the University of Twente, and we have looked at campaigns in the past that have positioned people who have an increased body weight as disgust eliciting. And then we've looked at more modern health campaigns and how they've shifted away from this kind of approach and promote more making healthy food choices the easy choices. I wouldn't say it has like a concrete, immediate impact on people. It's more a discussion of how the emotion is really embedded in our perception of what a healthy body is and healthy food consumption.
So we're working on explorative self-experimentation, and it's a project to help people help themselves.
The project is a very clear example of a human-centered design project. So we design a strategy where we try to find out that the user finds out what the preferences are, what their goals are, what type of behavior fits their own preferences. And one of the strong things in this strategy is that it requires the users to have an active reflection and evaluation on their own behavior. And using these insights, using this learning from experimenting, they will develop a sort of behavior change plan that they like and that they can sustain over time.
It's about finding what fits for them.
I became involved with this project because I'd noticed some health-related behaviors I had that I wanted to change. Very practical things like caffeine consumption and sugar consumption, and also sleep. So a lot of things to do with my energy levels, which I think for a lot of students is a very common problem. And throughout the course of the prototype testing, I reflected on these behaviors at first in very practical ways, thinking about actions I could take to improve these behaviors, but then reflecting on those actions and the way I was actually implementing them in my life, I realized that health is a lot more than just actions, it's about emotions too. And the underlying attitudes that I had towards my health were much more influential on my behaviors than the individual actions themselves. So being part of this project and using this prototype to help me to really reflect on myself as a person, much more than just those behaviors as individual things.
So we provide the users booklets and also a toolbox with some physical prototypes which can guide them to this process. They start with a few weeks of thinking about what behavior do I want to change, write the goal down, think about interventions they can do, and then they try out different interventions over time. So a main part is the reflection. And based on that, you will develop sort of your own behavior change plan that fits your own preferences and your own styles.
So one of the things that we want to do is to automate this process. So for example, using a conversational agent that can help you define your goals, find strategies that work to achieve your goals, and then evaluate it as well.
Also, we want to explore in which target group this strategy can work. People with chronic diseases or people with diabetes, see if this strategy fits this population.
TU Pride Prejudice program is an excellent example of how collaboration between different scientific disciplines enhance the impact of science and technology innovation on society. It enables knowledge exchange between people coming from disciplines that would normally not easily work together, As a result, they are able to research and design technologies that bring us one step closer to building a healthier future for current and next generations.